Welcome back to Beautifully Complex, everyone. I have Andrea Jones back with me on the podcast to talk about PANDAS this time and what it is. And even more importantly, I think, is what signs can we look for in our children? And if they have PANDAS, what can we do? So, Andrea, will you start by letting everyone know who you are and what you do?
Yeah, absolutely. So my name is Andrea Jones. I am a registered nurse, bachelor's of science in nursing. Not that that matters for everybody listening, but I, went to school for a fair amount of time to get my nursing degree and spent the first 15 years of my career working bedside in pediatrics before leaving the hospital setting and launching a functional medicine practice. So now I work primarily with women and children, with women on a lot of complex health issues, hormone balancing stuff, and then with families or children also that have complex medical diagnoses and really just getting to the root of those issues. So I left the hospital setting for a lot of reasons, but one of those reasons, which the timing is really weird when I look back because I actually resigned and then my daughter got sick 2 months later. And so I really see just there was kind of a grace on me not having to work 13-hour shifts, but I didn't know that that was coming. And so we'll talk a little bit more about that, but that's what I do. And I've got two girls, one of which who is recovering from PANDAS, and was diagnosed with PANDAS in 2018.
It's been several years then.
Yeah.
Yeah.
Half her life at this point. Yeah.
Wow. So talk to us a little bit about what PANDAS is first.
Absolutely. Yeah. So PANDAS has been around since the early 1980s, and it stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep. Now, there's kind of two umbrella terms that people are hearing more commonly now, which is PANDAS. And PANS is Pediatric Autoimmune Neuropsychiatric Syndrome, which can be from mold, Lyme, or any other type of infection. But essentially, it's the same diagnostic criteria, which is there is a preceding infection. For my daughter, it was strep. For many kids, it's strep. And that through molecular mimicry, which is basically the strep bacteria looks very similar to, the antibodies to strep look very similar to specific cells in your brain, and the body begins to attack those in the basal ganglia. And so that, for many kids, looks like obsessive compulsive disorder, anxiety, meltdowns, rage. There's quite a few symptoms that would fall in this category. But the diagnostic criteria is that, that acute phrase in there, which is that it typically happens very, very quickly after that strep infection. Now, I think that personally that needs to change. Professionally, what I've seen is that it's not always acute. Sometimes it's, we look back and he was getting sick a lot, and then his behavior started to change, and then they get the diagnosis of PANDAS. For my daughter, it was overnight, like within 2 days of her getting a strep infection, getting antibiotics, she was not the same.
Wow.
And so it was a very immediate, observable difference in her that scared the ever-living daylights out of me. And part of that was because I knew what PANDAS was. I had been trained to, observe for it in pediatrics. But in our hospital setting, we weren't really, and it could be because it's mainly diagnosed outpatient. That's probably why I didn't see it very much, but I didn't see it a lot in my patient care. I think I maybe had one patient that actually was diagnosed with that out of thousands and thousands of kids. And so,
Wow.
but I knew that it existed, and I knew that I needed to take this very seriously, that something pretty significant had just happened in her brain, and, just everything that comes with that, which is how long is it going to take to heal, and crap, now we're up a creek, and what do we do? So
Yeah.
I hope I answered the question, but that is the diagnostic criteria for PANDAS and what it looked like for us.
Is there a medical test?
There is not because it's technically a clinical diagnosis, meaning that we're looking at presentation of symptoms, but there are several tests that we can do to confirm or validate the diagnosis. One
Okay.
of those is a strep antibody test. And so, especially, if I have a kid come to me and they're like, this was pretty abrupt, like, and kids can be silent carriers of strep, which they may never
Hmm.
have actually had a sore throat, which is weird, but it does happen.
Yeah, I have one of
Whenever,
those.
yeah, and it happens a lot, actually, a lot more than you would think. And so it's a very cheap and easy test to do, meaning most physicians can order it pretty easily and get it covered by insurance. But that's the first thing we'd want to rule out is if they have elevated strep antibodies, that should warrant further investigation on what we're dealing with. And then if we really want to dig in like much, much deeper, we might do something like a neural zoomer, which is where we're actually looking at the neurotransmitters themselves and if there are antibodies against the neurotransmitters, which is amazing that we can see that. It's amazing that
Hmm.
we can get that information.
Is that a
So
blood test
it is a
also?
blood test. Yeah.
Okay.
It is not, for those that are familiar with it, it's similar to the Cunningham panel, which is more commonly used in conventional medicine. But the neural zoomer, I would say, is a little bit more specific. So not all physicians will order that, to my understanding.
And are there, like you talked about, that really abrupt changes in
Mm-hmm.
behavior might happen
Mm-hmm.
in, it sounds like, anxiety, things that feel
Yes.
OCD level. Is there anything else that might signal to a parent, hey, I should think about PANDAS, or I should talk to a clinician about this possibility?
Yeah. And I wish I had pulled up the list of symptoms because there's quite a few. For our
Mm,
daughter, it wasn't actually anxiety, it was rage. Like she would just
mm,
scream for hours. Like and she was 8 at that point. So it's like we are out of that stage. Like we're
yeah.
not in this stage of tantrums and meltdowns. And completely unreasonable, completely unreachable. And I remember like looking at her and feeling like she's in there, but I can't get to her. Like I
Mm,
can't, there was like this glossy look in her eyes. And actually looking back at pictures now, I realize it wasn't just my perception. Like she actually did kind of have this glassy kind of look to her eyes. And that's very common. I didn't know that at the time, but that is common. It's very common for these kids to have this kind of like, we call it an allergic shiner, but it's like purple under their
yeah.
eyes. Sometimes their eyes are really bloodshot. Uh, Emotional regressions where they can't sleep alone at night. Basically attachment anxiety, so where they're not wanting you to leave. So like she went through this huge period where I couldn't leave her at school. All of a sudden, she would have
Mm,
tremendous amount of separation anxiety. That she'd never really, I mean, she was my kid that when I dropped her off at the nursery at 11 months, she's like, bye, mom,
yeah.
like super easy going. For a lot of kids, they experience bedwetting where they weren't
Mm,
before or peeing a lot and where it looks like they have a bladder infection, but they don't. And so there's a lot of, I mean, the thing that I would say is that it really does impact almost every system in the body for these kids. But what we're looking for in the diagnostic criteria is that behavior shift, right? Where maybe all of a sudden they're complaining of intrusive thoughts or hyperactivity where they can't settle down or noise sensitivity. That was a big one. Like she didn't ever have noise sensitivity really before that. And now all of a sudden noises are really bothering her. So I can list some resources for like the symptom profile for families if that would be helpful. But those are common things that we see with pandas.
yeah, we can link some stuff up in the show notes on the website so that everybody has more information if they want to go and check that out
Yeah.
and investigate more. I'm just wondering, as you're talking, um, is it something that could resolve on its own? If you didn't catch it, could it resolve on its own?
The strep or the pandas?
PANDAS?
From what I have read and seen, no.
No. Okay.
It does not. There's some like anecdotal evidence that it resolves in puberty, but that's not been my observation. My observation has been that it actually just morphs into something different.
Gotcha.
Where, you have a little bit less hormonal chaos, once you get through puberty, but it's the mental health issues are there. They just look a little bit different. And so I personally and professionally don't believe that because of what I've seen, not just with my own kid, but with all of the other families, that I'm in contact with. It's one of those things that it really does have to be treated, and it has to be treated medically, not just like a psychiatric illness where it's like, okay, we might need meds, we might need therapy, the standard things that they might need. They're also going to need medical treatment because it is a medical illness.
Right. I asked because as you were talking, my kid, who is neurodivergent, is a strep carrier, never has had a symptom ever.
Yeah.
My other kid had like constant strep for a long time. And what we realized was they were sharing a tube of toothpaste. And we didn't know, we didn't know at the time that you could have strep and not have strep, right? And so he was just giving it right back to her over and over. But a lot of the things that you talked about at one point in time really fit for him, like really different stuff, but it has resolved over time. And so that's why I asked and not.
Yeah, it's a great question.
Yeah, I just wondered could it have
and I even
been?
Look back at I had strep all the time growing up. All the time. I would get it. They finally took my tonsils out when I was 7 because they're like, we're sick of this. 7 times a year. This is crazy. So I was on antibiotics all of the time. And then I developed OCD when I was 13. And I distinctly remember this fog kind of settling over my mind, a very slow progression. It's weird to talk about. But I remember sitting in my pediatrician's office and he's like, we actually need to rule out that this isn't PANDAS because of how much she's had strep. And because at that time, their diagnostic criteria was that it had to have happened within 2 weeks from the infection. Now they've broadened that criteria to say, well, actually, that's not 100% true. So I have always wondered, was I a PANDAS kid and I just never got diagnosed? It's possible. I think it's one of those things that we'll get better and better at recognizing, treating it, and addressing it appropriately the more we actually listen to families. I think that's probably the biggest thing.
Yeah, the more we talk about it and the more people's minds are open to it.
Exactly.
Talk to us some more about that treatment that you alluded to a minute ago. What does that look like?
Yeah. Yeah. So there's the conventional kind of standard of care treatment is antibiotics and IVIG for some kids, which is IV immune globulins, which kind of retrains the immune system. That was initially proposed by Dr. Sweeto in the 1980s. And so that has been a foundational treatment for a lot of families. Now, we know that antibiotics are not entirely harmless, and so you do have to kind of weigh those risks and benefits with your provider. I know a lot of families that have gone the route of IVIG and retraining the immune system. There's LDN, which is low-dose naltrexone or immunotherapy, which we know to be highly effective for a lot of these kids. We opted for something completely unconventional, which it's hard to, you live it and you're weighing this huge, I feel like the weight of the world is in my lap right now because I don't know how, what the right thing to do is here. I'm seeing families go this direction and not get better. I'm seeing families go this direction and not get better. I'm seeing some go in that direction and they do get better. Ultimately, what's the right thing for my child, And so whenever I'm talking to a family, I want to make sure I spend some time sitting in that space with them because it is such a heavy decision to and for me, I felt such a weight of, I know this isn't the question that you asked, but it kind of matters because I felt such this sense of urgency on time. Time is not on my side. Inflammation in the brain for long periods of time is not good, right? We need to get on this. And so because she'd already gotten antibiotics for the strep, we knew that was not something she needed, but I had personally administered IVIG and witnessed some of the side effects of that, and I didn't have peace about pursuing that personally. I was like, I just don't have like a gut sense that that's the right thing for me to do. So for us, we again went completely unconventional, and it ended up being the best thing that we could have ever done for her, which was to work with a homeopath that only worked with kids with PANDAS, and they serve like 20,000 families all over the world. So like they are the people, you know. And primarily because I was just watching families share, like, we've started this and this is what we're seeing. I had used homeopathy for myself and seen some really significant improvements. And so I was like, we're going to give this a shot, like, and just see. And I remember giving her that first dose and like seeing my kid come back. And I was like, oh, there she is. Like, I haven't seen you in a year. And here you are, you know? So what I want to say within that, there are so many different ways that we can support these kids, whether it's peptides or immunotherapy or low-dose naltrexone, anti-inflammatories, IVIG. You know, I think, again, the more that we're listening to families and really paying attention to how they're responding, we're going to get better at knowing what to recommend to them, because every family truly is different. What works for us may not work for the family next door to us, you know?
Sure.
Based on genetics and other factors. So I hope that answered the question. But yeah, the standard conventional is, you know, immunotherapy, IVIG, which is immunotherapy, antibiotics, and usually some sort of anti-inflammatory, whether that's steroids or ibuprofen. So that's kind of the typical, like, kind of starting point for a lot of people, I would say.
And is therapy part of that as well?
It can be, yeah, depending on, I would say it, I hate to use the word should, because I'm not a fan of that word. I would say many children really do benefit from that. And if the child's not benefiting from it, the family needs it, because it is incredibly stressful on the family system. I mean, our youngest daughter was 3 at the time that her sister was diagnosed. And so she didn't know, like, why she went from, like, she was playing with me yesterday and now she's telling me to shut up and get out of my face and I don't like you. And like, you can't, like, there's no impact from that. Right. So, for our daughter, we did have her do cognitive behavioral therapy. Mainly just so that she had a place where she could practice some skills outside of me, like teaching her, right? Like, I had to learn how to parent her differently, which I know we're going to talk about. That, like, this flipped every ideology that I have, like, how I'm going to parent 101 is now in the trash, because that does not work for these kids. So therapy, yes, if not for the child, then absolutely for the family members that need it, because everybody's going to need support. And we just kind of rotated whoever was struggling was in therapy that week. You know, so it wasn't a perfect, like, setup where everybody got to go every week, because financially that wasn't doable. But we did, therapy is helpful. Neurofeedback can also be really helpful for these kids, and just helping to regulate their brains too.
Awesome. So many things to think about. There's so many different aspects to it.
Which is why it's so overwhelming. Yeah. And I would just say, start where you can. Do one thing. You know, I know we kind of talked about this last time, but, like, start where you can. Do one thing that's doable for you. Observe how your child does, and then build in more as you're able. But this is a marathon. This is a marathon recovery. It is not a sprint. And I'm not sure that I fully understood that at the beginning, which I'm kind of glad I didn't, because I think that would have been terrifying to be like, actually, it's going to take her a while. Yeah, that's hard to hear. So
what does that time frame look like? I know it's different for everyone, but is there, like, an average block?
I've heard mixed things, and I really do think it depends on how long it takes for them to get the diagnosis. Some of these kids, it's just atrocious, like 10 years before they're diagnosed. And I'm like, that's insane. Like, at this point, it should not take that long. We know way too much at this point for it to take 10 years, you know, but I think it's getting a little faster than that. But I have heard some families say, like, yeah, we didn't get a diagnosis for 10 years. how long it took for them to get the diagnosis, how long it took for them to get treatment on board, and how effective that treatment was. I think those are probably the three things, the three linchpins that kind of determine how quickly. For us, we got the diagnosis immediately. We started, a round of various, treatments for her, antibiotics, anti-inflammatories, and not a huge response. Like, she just didn't respond to them very well. And so that's when we had to pivot to homeopathy because what we were doing was not working. Then we started seeing progress. So it did feel like some of that was wasted time, which I think does contribute to the length of time of recovery. What I'm hearing from a lot of practitioners is anywhere between 2 and 3 years is kind of the standard recovery. Again, depending on all of those factors, right?
Yeah.
So for us, it's been a lot slower than that, but I don't know that that's the norm. I don't know that that's the standard. I think that's just been our journey.
And when you use the word recovery,
Mm-hmm.
are you saying PANDAS and all of its behaviors and everything that came with it is totally gone? Or is it's better and this is our new normal?
Ooh, that's a good question. I would say, okay, so I probably should define that a little bit better. So when I say recovery, what I mean is that, and I think this is the definition I think this is maybe the clinical definition too, but don't quote me on that. I could be totally wrong because I haven't looked it up recently. When I say recovery, I mean, one, when she gets exposed to a virus or a bacteria, it no longer causes a neurological flare. She went from having a normal functioning brain that could have a fever to not ever getting sick, and it just attacking her brain every time she got sick. And so we actually had a party when she had her first fever, like 3 years in, because we're like, yes, her immune system is finally working. So now she gets actual illness, not neurological illness, which is a huge sign that the brain and the autonomic nervous system have recovered. Now, then that's like I wish I had a visual of this, but that's like your like your primal brainstem nervous system part of your brain. All of the learned behavior, right? The cognitive function, the emotional regulation, all of that comes after that part of your brain recovers. So we've seen just like this continual snowball of healing happen where she lost a lot of executive function, meaning she could unload the dishwasher before this happened. And I tried to like hand her a spoon. One day I was like, can you put this in the drawer? And she was like, I don't know what that is. Like somebody had a stroke. I mean, it was literally that bad. And so she has had to regain a lot of those skills, but they have come back. So for me, the definition of recovery is no longer having neurological impact from illness. That's a primary, like foundational definition. And continuing to recover everything that she lost. So emotional regulation, social skills, the ability to remember to take a shower and take the shower, the ability to remember to brush your teeth and actually follow through, like all of those types of things that our kids, quote unquote, should be able to do, right?
Yeah.
That she lost. And so for us, that's what that has looked like. I would say we're not at a point where she's 100% Alexis before she had PANDAS, but every day we're seeing more and more of her. Does that make sense?
Yeah, totally. Almost sounds like what you would expect from, like you said, a stroke or a brain injury.
Absolutely.
Like there's some relearning. There's a lot of recovery after getting the medical part straightened out.
Exactly.
Is that right? Okay.
Oh, absolutely. And I would describe it like a chemical concussion. And not from like a chemical substance, but like it's not a physical concussion. She didn't hit her head, but there's this inflammatory concussive type situation that we have, right? And so the recovery is exactly like you described, where it's like that's the best way I can communicate it to people. Like, imagine seeing somebody that's had a stroke and loses everything and they have to regain all of that. That's what this is like.
Wow.
Yeah.
Let's talk about the parenting then, because you said to me right from the start, you have to parent differently.
Yeah.
What does that look like? Like, how do you start down that
Oh
path
my
of doing it
gosh.
differently? Like, we talk a lot on this podcast in the neurodivergent parenting space about having to do things totally differently. So it's not a foreign
Yeah.
concept here,
Yeah.
but I imagine it probably looks different than what we typically talk about.
Yeah. It's I'm like, where do I even start on this one? Because it was so instant for us, that it was like I had to really recognize really quickly that she was not responding to the style of parenting I had done before, where I could say, hey, it's time to put your shoes on. Let's go to the store. Now it's a meltdown for an hour because her feet feel weird in shoes that had never been a problem before. Or because you're telling her she has to change her plan, which her plan was that she was playing with her dolls 5 minutes earlier. And now I'm telling her she has to go to the store. So at the very foundation, it was me having to own and recognize that her brain was different now. Her nervous system was different now. And that meant that I had to learn what I didn't know yet, which felt very overwhelming because I didn't know what I didn't know yet. So it was this, I don't fully know what I'm dealing with. On the outside, it looks like she's just kind of being a brat, of like, I don't want to put my shoes on and I don't want to do this and I don't want to sit in the car and, screaming at her sister because it was too loud in the car. So all of my parenting strategies, which would normally look like, there's a consequence for behavior, which might look like a timeout, or it might look like losing a privilege that you have later, something along those lines. None of that worked. So my goal in my parenting had to switch from I'm trying to get her to change her behavior to my only goal is that her brain heals and I stay calm. That's like, those are my only two goals. And then we have some boundaries within that, right? Like you don't get to hit people. You don't get to scream at people. You don't get to throw things. Like I'm not going to let you be a total maniac here. Safety in the home, primary number one. And I really had to let that go. And really kind of, this is the conversation I often have with people is like, we really need to look at what our goal should be in this situation, because my goal cannot be that I have an obedient child right now. She cannot access those skills. And so I had to do a lot of rewiring of my brain every interaction I had with her, because I'm like, she's doing the best she can, but she can't do that. And so how do I keep her safe? How do I keep her sister safe? How do I navigate her through this? And so it took a lot of undoing, like death to self.
Yeah.
Because everything in me was like, wow, I didn't realize how much I needed a sense of control in this situation. I don't have that. And I'm not going to find it in these interactions. So I've got to figure out how to do something differently. And there were definitely a lot of books that helped me with that. Understanding your child with intense emotions, I think, was a big one. I'm blanking on the name. I'll have to drop it to you to put it in the show notes. But The Explosive Child, I think, helped. Just in like rephrasing things, like instead of saying, can you do that? I would say, I need you to do that. And she would, that was like the magic wand thing for her. Like all of a sudden she would just do it. So there were a lot of strategies. I had a lot of trial and error, but I would say the biggest was really just understanding the deficit, understanding what she was not able to do, and then redefining my goals as a parent, for what parenting needed to look like now, because the goal couldn't be obedience. It just could not be.
Yeah.
It
sounds exactly like what we do for neurodivergent kids.
Absolutely.
Honestly,
it is.
It's, the explosive child is one of our like Bibles of how we need to
helpful.
Change our framework and reframe the behavior that we're seeing.
Right.
Thinking about won't versus can't, right? And stuff like that. And so, it's very, very similar. We don't have that medical component.
Right.
But the behavior component.
It's the same.
You have to shift for that in your parenting. Yeah.
Absolutely. Or you destroy your relationship with your children. And I think that's what I was not willing to do. And I didn't care, I got to a point where I was like, I don't care if the in-laws don't agree. with me, like, on this. I don't care if my friends don't agree with me on this. Like, I have to follow my gut, and my gut is telling me that this will get better, but I have to do this different. And it was hard. I mean, lots of sweat and tears, lots of them. Yeah, I was having a lot of internal meltdowns. So, and external ones, let's be honest. But yeah, I would say it's very similar.
Very similar. What else do we need to know about PANDAS before we wrap up?
I think just reiterating, I think I said this, but if I didn't, I'll just repeat it. I think just reiterating that it's, if you have a gut feeling that this is not quote unquote just, I'm putting up quotation marks because never just neurodivergence, right? I'm not minimizing that, but I'm saying if you have this just kind of hunch, like it doesn't quite feel right, and I feel like this is worth investigating. Worst case scenario is you're wrong, right?
Right.
But if you're right, then this has to be treated medically, not just emotionally and psychologically. And so I think that would be my biggest encouragement to families, is to listen to your gut. I am so thankful that we had a physician that immediately listened to me. And I said, I don't want to be right about this. I hate that this is a thought in my mind, but I'm suspicious. Like, I think we might be dealing with this, and please tell me if I'm wrong.
Yeah.
And he was
like,
I would love to be wrong. I would rather be wrong in this case. Yeah. And he's like, we're going to do all the blood work, and I think you're right, but we need to do the blood work just to kind of confirm that. And so we got very lucky with that. But I would say, don't be afraid to keep pushing for the help that your child needs. That this does get better and they do heal. But how they heal is going to be obviously very different for every family. Those contributing factors, like we talked about, you are going to have to change your parenting. So get support on board as quickly as you can for the parenting aspect, because this is a marathon. That's the thing I didn't know. I was like, oh, and 6 months from now we'll all be, I don't know. That denial kept me safe to some degree, I think. But get that parenting support on board as quickly as you can. Parent coaching, parent therapy, whatever it is, because it will flip things upside down. And I like to think it made me a better mom. I think it did. Do I wish it had been a different way? Yes.
Yeah.
In the character development aspect, I wish I could have formed those skills not going through that hell, but here we are. So
yeah. One more quick question for you. Do you feel like mainstream pediatricians have this on their radar now? Or is this a case where a parent needs to go in and say, this is why I think it's this, can we explore it?
It's a really good question. I am split right down the middle on that one, because I do think they're getting better at recognizing it. But even like the first doctor we went to, which was like our naturopath at the time, didn't really take me seriously on it. And you would think a naturopath would be more inclined to, just because of their training. But I would say it's 50-50. So I would say go in prepared with what you need to be prepared with, to say, I'm concerned about this and I want to rule it out. And that's more than fair to ask for. Like, it's your insurance that's covering it. It's you that's paying for it. So it's okay to make that demand, If they don't listen to you and you still have that gut feeling, find somebody who will. It's worth ruling out, in my opinion. So I do think that they're getting better, but I also know, like, I remember reaching out to one of my favorite, actually, immunologists at the hospital, pediatric immunologist, just because I was curious what her thoughts were on all of this. And they're still very skeptical of it. Like, in immunology, they're like, oh, that's a neurological problem. Well, I went and talked to my neurologist pediatrician friend, and I was like, hey, what do you think about this? He goes, oh, that's immunology's problem. And I'm like, well, they say it's your problem. So whose problem is it? Like, it affects
Someday
both.
we have to,
talk to each other.
Accept that all of these things work together.
Exactly.
They're all connected.
Exactly. So I was like, okay, so this is where things are still at. Now, I do think it's getting better. Especially, we're seeing a lot more of it talked about on social media, more in the functional medicine space, I would say, than conventional. But I like to carry hope that conventional medicine's not too far behind. So
Good.
I think it's hit or miss, but my advice with that would just be to come in prepared, be willing to ask for what you need. And worst case scenario, they say no, and you find somebody else that's willing to rule that out for you. That's kind of what I did. I was like, I really want to be wrong about this, and that's what I said. But I feel like we need to investigate that this might actually be happening. And that seemed to be pretty well received. So
Good.
yeah.
Good. Yeah, things are changing for sure.
Hopefully. Yeah, let's hope.
Not
That's
as
my hope.
fast as we'd like, but they are
No,
changing
but it
for sure.
is. I do think it is. In general, I do.
Yeah.
Yeah.
Well, thank you, Andrea.
Oh,
I
thanks for
am
having
going
me.
to add some links that you provide for
Yes.
more information for people about PANDAS and PANS. And I will put those in the show notes on my website.
Awesome.
There will also be all sorts of links to Andrea's website and social media and her work. So if you want to connect and learn more or potentially work with her, you can do that as well. So all of those resources will be there for everybody. And I hope you'll check them out. Thank you so much.
Penny.
It was really informative. I'm happy to have learned a little bit more. So yeah,
well, thank you
it's
for
something
having
we definitely need to be talking about.
I agree.
Appreciate you. Well, thanks
Thank
everybody
you.
for joining us. I'll see you next time. Take good care.